Welcome to Practice Test 2 for Basic Veterinary Pharmacology. This practice test will serve as a review for Chapter 1 of the course about the scope of veterinary pharmacology and to prepare students for the summative test. For the instruction, answer the following questions by choosing the most appropriate answers. Justify or explain your answers accordingly. The first student to answer correctly with the right explanation will earn bonus points for the lecture. For question number 1, a German physician and botanist who compiled the first pharmacopoeia. A. William Harvey, B. Edward Jenner, C. Valerius Cordus, D. Theophrastus. Question number 2. Advocated little use of drugs, maintained very high ethical standards of practice, above all, do no harm. A. Claude Bernard, B. Oswald Smithberg, C. Paracelsus, D. Hippocrates. Question number 3. He published seminal work in 1948 that divided adrenoceptors into alpha and beta adrenoceptor subtypes. A. Raymond B. Alquist, B. Sir Henry H. Dale, C. Rudolf Bochheim, or letter D. Jabir Ibn Hajar. Question number 4. It is the study of prediction of drug responses between individuals based on their genetic makeup. A. Therapeutics, B. Pharmacogenomics, C. Neuropharmacology, D. Applied pharmacology. Question number 5. During this phase of new drug development, a drug candidate is subjected to short-term toxicity testing. A. Phase 1, B. Phase 2, C. Phase 3, D. Phase 4. Question number 6. A drug screening method adopted when there is no prior pharmacological knowledge of a test compound. A. Program screening, B. Simple screening, C. Blind screening, or letter D. Double screening. For the last question, the name for the active ingredient in the medicine that is decided by an expert committee and is understood internationally. A. Chemical name, B. Proprietary name, C. Non-proprietary name, or letter D. Trade name.